Guys, this is the real me. I'll look at the end of a shift. These masks. I'm wearing this FFP3 mask. I don't know why my eyes are suddenly not red anymore, but they were red. I am tired. I'm gonna finish the vlog and let you guys know what happened. So it was her first baby and her whole pregnancy had been low risk. She had literally just had a PCR test and got the results back that she was COVID positive the day before. But the midwife who was looking after said she's not even coughing or anything. She just has the sniffles a little bit, but she's cool. You wouldn't even know, she's not symptomatic. That obviously, like, we have to put on our PPE before entering the room and then take it off and all of that stuff. So I was like, cool. The only thing about her is that blood is definitely needed, as her rhesus factor was negative, which means she had anti-D in pregnancy as well. So we'll just need cord blood to see if the baby's also rhesus negative or positive. She was actually 2 centimeters. I just received handover from the midwife and curated a plan with her, and she had the C.O.G drip, hormone drip, which helps her uterus to contract because she was actually induced. When she found out she had COVID, she just wanted to be induced and just to bring everything forward. She was about 38 weeks, so it wasn't too bad. She had the hormone drip in situ, and every 30 minutes you can basically increase it depending on how everything was going. She was actually contracting about 4 in 10. So it wasn't too bad, but the contractions were quite spaced out, so we would increase it, then it would be, she wouldn't be tolerating it well, and baby wouldn't be tolerating it well, so we'll decrease it, then increase it again just to keep the contractions going. She wasn't a fan of the epidural, so she was using gas and air, but it was a lot for her. Like, it was taking its toll, I'd say. So yeah, on the CT trace also, there was quite a lot of decelerations with the contractions, but so this is when baby's heart rate drops down when the uterus is contracting. Obviously this is normal, baby's being squeezed, so the heart rate's going to go down, and these were less than 60 seconds and they recovered back to baseline quite quickly. So they were uncomplicated decelerations, and every hour basically we were doing a CTG review as well as mum's pulse, and then normal 4-hourly obs as well. And that was literally what we was doing for this lady. So she had already had pethidine, which is an injection that is intramuscular put into the thyroid or buttocks, and basically this helps with the contractions. Kind of it will make a woman quite sleepy, a bit drowsy, so they can actually relax in between the contractions as well. It doesn't take away the contractions. So I went with the midwife to prepare this, and I actually was able to give it to her as well, learning about how it's a midwife exemption, but the midwife can only give 2. If you're going to give her more than 2, you need to discuss it, and it has to be confirmed and prescribed by the doctor. Because of the effects of pethidine, it's given with another drug called cyclazine, which is anti-sickness, but pethidine can be given 4-hourly, cyclazine 8-hourly. It hadn't reached 8 hours yet since she had her last pethidine and cyclazine, so we gave her the pethidine. But what we decided was, if she was to feel sick, would give her ondansetron IV through her cannula, which is also an anti-sickness medication. The next thing on the agenda was to examine her and see how far along she was, and I actually did the examination. Guys, I've never felt a cervix like this before. You know, examination, sometimes you don't even know what you're feeling. But I literally felt it here. I was so gassed. I went in, felt around baby's head, found the cervix, and I found that it was about 1 centimeter long. They say long, but I was thinking about its thickness. But 1 centimeter long. It was, I would say, in the middle, so it wasn't posterior, because on the last examination they said it was posterior. So I said it was mid, and I was able to open up my 2 fingers quite wide. So upon this examination, I said she's 4 centimeters. Midwife also examined her and confirmed it. So I got something signed off on my pad, which is able to accurately assess progress of labor from latent to active or stage or something like that. So yeah, I was so happy. It was a really good examination. It was a really good experience. And it was loosely applied to the baby's head. It wasn't firmly applied, but it was a very, very soft cervix. What it felt like to me, some people might think this is weird if they felt it, but to me it literally felt like a flap that I could put my fingers into and see how much it opens, kind of thing. That's literally what it felt like to me. But now I know what I'm trying to feel when I'm doing examination, because I'm not gonna lie, I've just been doing freehand examinations and just trying to feel what I can feel, do you know what I mean? So yeah, we continued all her observations as normal, C.G reviews, and then the call bell had went off. I went to see what she wanted, and she said that she needed to use the toilet. And basically, because of the decelerations and stuff, we didn't want to detach her from the monitor, so I brought a commode in and she sat on the commode. So when we got her up, she started to kind of throw up, like make those nausea sound of noises, but she threw up like 15 mils, which was nothing, like not much. So got the commode, got her to sit on it. She sat on it for about 20 minutes and nothing came out. It was very weird as well. We wasn't seeing any fluid draining. Her waters had broken, but just no fluids the whole time we were looking after her. So when nothing came out, I got her back on the bed and I called the call bell for the midwife to come in, because I thought it's very long if I take off everything I'm wearing, all my PPE, and then go out and get the midwife. Also, that's why I was wearing scrubs, because I felt more comfortable looking after her wearing scrubs than my uniform, and taking my uniform home to go and wash it after I've looked after someone with COVID. So yeah. But yeah, anyway, so she came in and she said that we'll try in another hour and get her on the commode. If nothing comes again, we can do a catheter if she feels like she needs to use the toilet. So another hour came, we got her on the commode and she let loose. She opened her bowels, everything. And to me, I felt like, oh, this is like progress. She's making more space for baby and everything. She had been drinking quite a lot in labour as well. But guys, imagine. So a lady came from the induction bay and I could see on the board that she had just had an examination and it was confirmed that she was 7 centimeters. But the noises this woman was making was like she needs to push, or she's pushing. So I literally wrote her name on the board and everything, and I asked the midwife in charge if I could also go and look after her. So I asked the midwife who was looking after her, who is amazing, inspirational to me. So I was a bit nervous, like actually caring for a patient with her in it, because she's really good. I've heard great things about her. I went in there, she said yeah, of course, and then we looked after this lady. I did a set of obs on her. She was on the C.G monitor, which was actually not really needed. We ended up putting a stand clip on baby's head just because we couldn't pick up the fetal heart rate properly. She was pushing, she was going for it, letting her body do what it's doing. I could see that this midwife wasn't too fussed about sterile gloves and this and that, because birth isn't sterile anyway. You're going to be touching stuff anyway. So yeah, we let her do what she was doing. I was trying not to say too much, like chin to your chest and push down as hard as you can and all of those stuff, because a woman's body knows what it's doing. Sometimes when you say all of that stuff, well, I'm learning about it in it, but I don't think all of it's completely correct. Like when they tell women to open up their legs wide, that's actually closing up the pelvic outlet, so it doesn't really make sense. But she was on her side and going for it. So eventually we were starting to see baby's head, but there was starting to be deceleration, and I was guarding the perineum, put my hands on baby's head as well. But I think not that she needed some help, but I'm actually in this, I'm just very gentle. So the midwife in charge was also in the room, and she was like, let's swap hands quickly. And she kind of like helped to bring baby's head down a bit. She told me to bring my hands. And then afterwards, I helped her birth her beautiful baby and placenta. And that was number 23. And it was great. It was amazing. So rubbed baby with a towel to stimulate the cry. Put baby on top of mum for skin to skin. And then drew up some syntocinon. And because she was low risk, they didn't see the need to give her sintometrin. And I know at the beginning of this vlog I was talking about sintometrin in it, but each their own, what can I do? She didn't have a PPH anyway, so yeah, syntocinon. Drew that up, gave it to her with her consent, and then felt the cord, and it had stopped pulsating. Clamped and cut the cord with dad. clamped the placenta, and the midwife was actually talking to the midwife in charge, but the placenta was coming, so I was just delivering the placenta, and the placenta came just like that. Her blood loss wasn't much either, but I forgot to say she had an episiotomy. So she had an episiotomy to give more room for the baby to come, and that's a cut on the vagina. So obviously that was bleeding, so that had to be sutured, and I just helped with like providing a light source, with holding things when necessary and getting things for that to be sutured, done baby's normal checks, mum's checks, got them something to eat, helped mum go to the shower, made them comfortable, and eventually documentation and stuff, and eventually took them upstairs to the postnatal ward, and they were very happy. It was really nice. They were an amazing couple, lovely, and it was a beautiful birth. I know I'm rushing through it, but yeah, this is going to be long because after that one on my break, and that was around like 5:30. It's a very late break. Guys, the tiredness is real. So I came back from my break, ready to get all the midwives I've worked with to sign things, because I'm not working hard for free. Well, I love what I do, but you gotta sign my stuff in it. Yeah, then I asked the midwife I was working with earlier how the lady I was looking after was, and she was like, "We're going to theatre." I said, "What?" I thought this one was going to progress, and she said, "Baby just has not been tolerating the contractions well, and on her next examination she was still 5 centimeters, so they're going to theatre due to the progress that had been made." So yeah, they found that, I don't like the term failure to progress, is very harsh and demeaning, so I don't really say that, but yeah, due to the progress they were going to theatre. So she asked me to help her, and I helped her. We're getting mum ready and stuff, but the D-cell, some long D-cell, I went to get the midwife in charge, and we're seeing what to do, what didn't, recovered back to baseline, and we ended up in theatre. And in theatre I was holding the abdominal transducer in place to pick up baby's heart rate. I also put the catheter in. I also used a swab that was on a piece of scissors and put in a sterile solution to do the cleaning of the vagina. Also scrubbed up, put on a gown, gloves, hat, everything, scrubbed up from top to bottom. We were wearing the white mask that I showed you in the previous clip as well, because she was COVID positive. So I put everything on, ready to get baby. And as I've said before, cesarean section is layers, like it's layers. And I even saw her use something that was like, it looks like it burns or melts parts to get into. Yeah, this one was very graphic and detailed. I was very close to it. She put her hand in and really get baby's head. And then we showed mum and dad baby, and they were so happy, stimulated their cry, took baby to the resuscitator. I had the baby doctor there who didn't do much because baby was totally fine. I done all of baby's checks, took baby to mum skin to skin, and a few other stuff, and then the next midwife came for handover. So after that I went to chase down everybody I've worked with to sign my stuff. But yeah, ultimately that was today's shift. Baby number 23, an emergency cesarean section. It's been a good day. Everybody is cool and everybody is good, and that's the most important thing. But yeah, until the next one, I'm gonna leave you guys here. Okay, bye.